Should this be, is this the good tilt?
Yeah,
Want it there more, or
that's perfect.
do you want it
No,
up
that's good. Yeah.
more?
Thank you for those of you who just joined us. We'll get started momentarily. Thanks so much for joining.
Isn't it nice out?
Mm.
Dr. Esselstyn, are you ready to start?
Yep. All set.
All right, everyone. Thanks so much for coming to the webinar today. Before we get started, just want to just say hi to everyone. My name is George. I'm with Lifestyle is Medicine, a non-for-profit organization here in Toronto that's promoting lifestyle medicine. But before we get started, just a few housekeeping items. So first, this is being recorded and live streamed, and so just adjust your camera and your audio accordingly. So this is being recorded and this is also live streamed on Facebook. We're going to take questions and we'll try to get to as many questions as possible, but we'll take the question at the end of the main discussion. So if you have a question, please put it in the chat box as we're discussing, and we'll try to get to as many as we can. All right. Also, this program is put on by two organizations, Pathways to Wholeness Lifestyle Medicine Center, which is a lifestyle medicine and naturopathic clinic here in Toronto. We do naturopathic and lifestyle medicine. The other organization is Lifestyle is Medicine, which is a not-for-profit organization that puts on lifestyle medicine programs for the community. All right, so today we'll be discussing heart disease. which is a major issue here in North America and across the world. And even during this time of COVID-19, some of you might be aware that one of the major comorbidities with COVID-19 is actually cardiovascular and cerebral vascular disease. And so we want to tackle this head on today and see, are there lifestyle medicine principles that we can apply to not just prevent, but also even potentially reverse this major killer? And to discuss that with us, we have someone who is eminently qualified to discuss this topic. We have here Dr. Caldwell Esselstyn. Dr. Esselstyn is no stranger to the lifestyle medicine community. He's a medical doctor and trained as a surgeon at Cleveland Clinic. He went on to serve as a surgeon during the Vietnam War. In the 1990s, Dr. Esselstyn got some landmark results studying the effects of healthy nutrition for coronary heart disease reversal. Since then, he has been at the forefront of lifestyle medicine and continues his work in spreading the message that how we eat has not only the power to prevent, but also even potentially reverse today's major chronic diseases, including heart disease. He's published a book called Prevent and Reverse Heart Disease, which discusses his findings and the benefits of healthy plant-based nutrition. He's also featured in several documentaries that have been pivotal in many people's journeys to switching to a healthier nutritional pattern. Forks Over Knives and What the Health. Forks Over Knives features him and his good friend, Dr. T. Colin Campbell. He's also done TED Talks, which you can find online. He's also published over 150 scientific papers, and he currently directs the cardiovascular prevention and reversal program at the Cleveland Clinic. He's also a fellow of the American College of Cardiology. When it comes to lifestyle medicine in general and plant-based nutrition in particular, Dr. Esselstyn's work has and is inspiring a whole generation of doctors and more to come. We're so pleased to have Dr. Esselstyn take his time to join us today. Dr. Esselstyn, welcome to Lifestyle Med Live.
So I want to say thank you. And I think I work at the Cleveland Clinic Wellness Institute. All right, that's a distinction from the downtown cardiology. We have it also at the Wellness Institute. Happy to be with you, and remarkable. I'm in awe of this modern technology that allows this to happen.
Great, I'm so glad that you're joining us. So when we sent the email on your website first, I was shocked that your wife responded saying that you could actually have the time to join us. So thank you so much for making the time to be here. Well, today we want to discuss your work with heart disease and plant-based nutrition and so forth. And before we get into the thick of things, I want to just impress our audience about how serious heart disease really is. And to do that, I want to share with you a quotation from one of your papers, and I want you to ask you to unpack it. So first, I'll read this for our audience's benefit. This is from one of your papers in 2016. It says, and you wrote, "The nation was paralyzed at the thought of an Ebola pandemic. Millions were spent in preparation for this epidemic. One case of Ebola occurred. In December of 2015, 14 persons were shot to death in a terrorist attack. Both of these events rightfully provoked a national outcry. Nevertheless, every 2 weeks, there are cardiovascular deaths occurring, which are equivalent of 2 capacity-filled jetliners crashing. This is regarded as unfortunate. This overlooked mortality can no longer be acceptable." And in 2017, you wrote here, "It is increasingly a shameful national embarrassment for the United States to have constructed a $1 billion cardiac healthcare industry surrounding an illness that does not even exist in half of the planet." I don't think a lot of people realize that our major killers, in particular heart disease, is in some parts of the world it doesn't even exist. Can you unpack that for us?
Well, that's I think the thing that really gets everybody a little bit concerned, because it absolutely makes no sense, because we have now known for really over 80 or 90 years cardiovascular disease, which was very infrequently identified at the transition from the 19th century to the 20th century. In other words, around 1900. It was very infrequently identified, but suddenly it began to pick up steam. And really, since about the last 80, 85 years, the number one killer has been cardiovascular disease. And we have absolutely done incredible amounts of research. There have been tens of thousands of papers written about this disease. But it's just so shocking to think that this disease doesn't even exist in Okinawa, rural China, Central Africa, the Tarahumara Indians in northern Mexico, the Papua Highlanders in New Guinea. You know, what's going on here? The Tarahumara thrive on the three sisters, beans, corn, and squash. And increasingly now, we do understand the mechanism behind all this and why it is that we have this epidemic, and it's the food. And yet nobody seems to be able to really get down really to the bottom of this. And it's very difficult because of the resistance that's out there to get people to make change their lifestyle. For instance, the government is working against us. When you think about it, every 5 years, the government makes a plate, or they have recommendations of what the public should eat. And let's remember that the United States Department of Agriculture, who makes this, all the officers in the the United States Department of Agriculture, all these officers previously were the president of the Cattlemen's Association, the Dairymen's Association, the Pork Board, the Egg Board. I mean, it is such an enormous conflict that every 5 years, when the plate comes out of what Americans are supposed to eat, if the Americans eat it, then millions are going to perish.
Thanks so much. And for our viewers, the pictures here, Dr. Esselstyn mentioned Tarahumara Indians and also the Papua New Guinea Highlanders, and these are groups that he references in his papers, are groups of people who pretty much heart disease is very infrequent. So here you have some groups of people where heart disease almost doesn't exist. And Dr. Esselstyn, you wrote that, people it's almost like we've accepted heart disease as just part of our life. You get heart disease, it's like, okay, well, it's kind of, we expect it, but you're saying that in the parts of the world they don't even know what heart disease is. And
how often do you suppose the Okinawans get their cholesterol taken? Yeah. Right.
Right. Yes. Now, let's discuss then conventional approaches
Well,
to.
there is one other interesting point. Since you've got the Papua Highlanders on the screen, when they have been carefully studied, there's several things that stand out. They smoke a very harsh tobacco, and they do it in a communal hutch, so that if you're in there with everybody else smoking, you get not only the benefit of your own smoke, but everybody else's. And they have a very high rate of, obviously, of pulmonary disease, lung disease. Here they are living in this pristine atmosphere, 18,000 feet or more at the Papua Highlanders. The air is clean and beautiful unless you're smoking in that hutch. But when a series of autopsies was done of the Papua Highlanders over the age of 60, despite all this smoking, zero heart disease. All right, why is that? Well, what do they eat? 19 different varieties of sweet potato.
Yes, absolutely amazing. So let's get to conventional treatments, and I want to impress our viewers about some of the things that you've written about conventional treatment for heart disease. And I want to show them some quotations here, and I want to get your comments. So here you wrote, "The time is long overdue for legendary work. We can hardly be proud of a drug and interventional therapy that results in death, morbidity, inordinate expense, and disease progression. Present coronary artery disease therapy need not become the radical mastectomy of this century." And then you wrote, "Modern cardiology has given up on curing heart disease. It is time to call this by its true name, palliative cardiology." So you're comparing the conventional ways of treating heart disease as the radical mastectomy, and you've labeled it palliative cardiology. I think that might surprise a lot of listeners because for most in the general public, they might think of surgeries as like the ultimate form of therapy. Surely, if you've gone through a surgery, you've cured the problem, but you're saying it's not. Can you unpack that for us?
Well, did you mean about this, the surgery for breast disease? Because the radical mastectomy was devised in 1882 by William Halsted of the Johns Hopkins Hospital. And it was really a brutal operation. It removed the entire breast, all the skin over the breast, all the muscle under the breast with a radical lymph node dissection. And it was painful, it was mutilating, and it was disfiguring. And there are many women who would rather watch the lump in their breast than have that operation. But Halsted was such a towering figure that his writings about this were like a commandment. And it was interesting that it finally took about 70 years when finally there were courageous surgeons who began to challenge the Halsted concept of breast surgery. And they found that lesser procedures were equally successful. And the same thing actually can be said nowadays about cardiology, because my concern with the way cardiovascular medicine is practiced today is that we have all these drugs and we have all these procedures. We have stents, we have bypass surgery, and we have drugs. And guess what? Not one of those items has anything whatsoever to do with the causation of the illness. And ever since the days of Hippocrates, there's been a basic covenant of trust that wherever possible, the caregiver will share with the patient what is the causation of the illness. And sadly, today in cardiovascular medicine, that's simply not being done. Well, it doesn't do any good to just make statements like this. You've got to do the research. And back in 1984, when I was still actively involved in surgery, I had a small group of patients who were seriously ill with triple vessel cardiovascular disease. And there had been a number who had failed their first and second bypass surgery. They had a number who had failed their first or second angioplasty, and there were several who were too sick for this procedure. And there were 5 who were told by their expert cardiologists they would not live out the year. Well, those 5 made it beyond 20 years, and we began to see some very exciting things with these patients who were willing to make this lifestyle change to whole food plant-based nutrition and to eliminate the foods that were injuring the delicate innermost lining of their artery every time those foods would pass their lips.
Right.
We can get into a fair amount of detail on that, because I think it's pretty exciting for people to understand how it is that this disease develops and how it is that we're going to empower patients as the locus of control to halt and reverse their disease.
Right, and let's get into that. So you've done studies which shows that you could literally reopen up these coronary vessels. And for those who are watching, the picture on the left is a picture of one of the patients, I believe that Dr. Esselstyn you treated, and
He was a surgical colleague.
Yes, and A is before plant-based nutrition and B is after, and you can see that it's opened up. Also, you also helped Bill Clinton, as I understand, when he was going through heart issues as well. So can you tell us, Dr. Esselstyn, what is the program you're putting these people on to see such dramatic results?
Exactly. Well, I think we're all experts would agree that where this disease has its inception, its onset, its beginning, is when we progressively injure the life jacket and the guardian of our blood vessels, which happens to be called the endothelium. And the endothelium manufactures a truly remarkable molecule of gas called nitric oxide. And it is nitric oxide which is responsible for the salvation and the protection of all of our blood vessels because of its remarkable functions. For example, number one, nitric oxide keeps all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, protect us from getting high blood pressure or hypertension. Number four. Now, number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing blockages or plaque. So literally, everybody on the planet Earth, whether they're from London, Berlin, Chicago, New York, or Toronto, if they have cardiovascular disease, it is because by now, in the preceding decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into a train wreck. They no longer have enough nitric oxide left to protect themselves from making blockages and plaque. However, the good news here is that this is not a malignancy. This is a completely benign foodborne illness. And once you can get patients to never again pass through their lips anything that is going to further endanger their endothelial system, then the endothelial system recovers, makes enough nitric oxide so we can not only halt disease progression, but we often will see examples of disease reversal. Now, what are the foods that every time they pass your lips, you injure the endothelial cells? One, any drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil on a piece of bread, oil on a salad dressing. Oil injures the endothelial cells. Number two, and anything with a mother or a face, meat, fish, chicken, fowl, turkey, and eggs, and anything that is dairy, milk, cream, butter, cheese, ice cream, and yogurt, and sugary drinks, diet colas, Pepsi and Coke, and I don't like sugary foods, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. Sugar injures endothelial cells, as does, for my patients without heart disease, they can eat nuts and avocado, but if they have heart disease, no nuts, no peanut butter, no cashew sauce, no avocado, and no coffee with caffeine. Decaf, yes. Tea with caffeine, yes. Coffee with caffeine, no. Now, there's something we've added in the last 8.5 years. It's not in my book. And that is, we try to get the patients to imagine shrinking their head to a size that it could crawl inside the artery to their heart. They could see that the blockage is an absolute cauldron of oxidative inflammation. So we need antioxidants, but no, do not go down to the health food store and buy a jug of pills that says antioxidant because it doesn't work and it's going to be harmful. No, you are going to get your antioxidants from food. Fair enough. What food? Food that is high in what we call ORAC value. ORAC, oxygen radical absorptive capacity. So if you're having raspberries, blueberries, strawberries, and blackberries on your morning oat cereal, that's terrific. But nothing can trump the antioxidant value of green leafy vegetables. So I need you to chew, not smoothies, not juicing. I need you to chew a green leafy vegetable 6 times a day that is roughly the size of 3/4 of your fist after it has first been boiled in water 5.5 to 6 minutes or steamed until it's nice and tender. And then you must anoint it with several drops of a delightful rice vinegar or balsamic vinegar, because the acetic acid in the vinegar will restore the nitric oxide synthase enzyme contained within the endothelial cell that is responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3, mid-afternoon 4, dinner time 5, and of course I adore it when you have that evening snack of kale. What are you doing? All day long, you are treating this disease with medicine's most powerful antioxidants. And the second thing, the second benefit from chewing the greens is it stimulates your bone marrow to make more endothelial progenitor cells. What do? They replace our senescent, injured, worn out endothelial cells. Now, what about the third thing? The third thing that chewing the greens does, so important. When you are chewing a green, you are chewing a nitrate. As you chew the nitrate, it is going to mix in your mouth with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria will reduce the nitrates to nitrites. Now, as you swallow the nitrites, your own gastric acid will further reduce the nitrite to more nitric oxide, which can now enter your nitric oxide pool. So here's what you're doing. With essentially no added expense, no hideous side effects, it is all day long. You are absolutely restoring nitric oxide, the very molecule, the deficiency of which has given you this disease in the first place. Now, what are the greens I'm talking about? They are bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, snapper, cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula and asparagus. And the top 5 are kale, Swiss chard, spinach, arugula, beet greens, and beets. And look what it does for your memory.
Also, it's very interesting. You said that it's a foodborne disease, and in medical school we learned that foodborne refers to like food poisoning. You eat food, but in a different sense that food, what we eat, is causing major chronic disease. But if you switch it around, you can actually start reopening these arteries, like it shows in this picture. I think more people really need to hear this message. And I want to show our viewers some more pictures from your studies here. And you can see before and after. You can see
this was a 67-year-old retired pediatrician. This is as small a reversal as the naked eye can see. This is a left anterior descending coronary artery, which is from the left to the right. And I should mention that all these angiograms were reviewed in the Cleveland Clinic Angiography Core Laboratory by senior technicians that do this all day long for national medical trials. So when I give you a percentage, I know that it's correct.
some more.
This is a 58-year-old factory worker. You're looking at the circumflex artery to the back of the heart. From the left to the right, this was described as a 20% improvement. This happens to be a 54-year-old security guard, and this is the right coronary artery. And from the left to the right, it was a 30% improvement.
I mean, these pictures are amazing. I mean, you can see that visibly, like these arteries are opening up again. Now, can you? I was at your talk in 2018, I believe, where you speak at the ACLM, and you were talking about quite recent discovering about how these things got TMAOs and the gut bacteria, and how these might actually play into cardiovascular disease progression. I don't think a lot of people know about this connection yet, how animal foods links with the bacteria and so forth. Can you maybe unpack that very quickly for us?
Yeah, this is the work of Stan Hazen from the Cleveland Clinic. And what Stan was interested in was that people who are omnivores, who will eat all kinds of beef, seafood, lambs, pork, dairy products, all those animal foods. He was looking at 2 molecules, essentially a Hold on a minute. Choline and one other that escapes me at the moment. But what was fascinating to me was that when they study these patients more thoroughly, it was apparent that if you are an omnivore, your gut contains bacteria that will metabolize lecithin and carnitine. And what happens is you now get a product called TMA. So lecithin and carnitine metabolized by gut bacteria to TMA, trimethylamine oxide. And that gets rapidly oxidized by your liver to TMAO, trimethylamine oxide. And trimethylamine oxide will injure your blood vessel.
Yeah, it's amazing like how science keeps on discovering new mechanisms, but the
Yeah.
same message though, that plant-based nutrition is the healthier way to eat. And now with this gut bacteria connection, it just reinforces why what you've been saying for so many years is true. Now, what if some people push back and say, how about the Mediterranean diet? You know, some people say, you know, there's studies of a Mediterranean diet. It's healthy for you. And many doctors and even registered dietitians, they say, you know, try the Mediterranean diet. So what would you say to that?
Well, there's only one diet that has ever been shown to take patients who are seriously ill with heart disease and halt and reverse the disease. The Mediterranean diet is a lot better than the typical Western diet, but it still contains animal protein and it still contains some dairy. And as long as you have dairy and animal protein, you really set the stage for establishing this disease. Yeah. So it's I guess you can say if you'd like to have a small heart attack or a small stroke, you could use the Mediterranean diet.
It's very interesting. You say that the only diet that's been shown to reverse heart disease is the plant-based diet. I don't think a lot of people realize that. I think a lot of people think that there's so much research behind Mediterranean diet, but you're saying that the only diet that
Well, there's no question when you see all the articles about the Mediterranean diet that are financed by the oil company, yeah, you can see a very favorable report.
So then what if someone says to you, and then they've been reading in the news and so forth, and they say, you know, Time Magazine's butter is back, and there's even some peer-reviewed studies and so forth saying that, you know, saturated fat might not be an issue. So what would you say to that?
No, all you do is you just, what I said before, and I'll say it again. There has never been a study of patients seriously ill with heart disease where you give them butter and bacon and ice cream and have the disease halted and reversed. It doesn't happen.
And my guess is you're not favorable towards the ketogenic diet either.
Well, no, it's got meat in it. And as soon as you put meat in the diet, then you get all these diseases. You get hypertension, you get diabetes, you get cancer, you get heart disease. No, ketogenic is show me a single study with ketogenic diet of patients seriously ill with heart disease where that has ever done anything in the way of halting and reversing. Doesn't exist.
Right.
But see, anybody can write a book or get a magazine. What you have to do to be legitimate, before you write a book for the public, have you done the research beforehand that has been published in a peer-reviewed scientific issue? That's the key. The rest is hype.
Right.
So it's the kind of thing we're going through right now with this COVID-19. You know, people are coming out of the woodwork with all these various therapeutics that some of them have shown some promise, but it has never been peer reviewed, and it's really just anecdotal. But it'll come about. And it won't be too long because this disease is so fast, and either you get better or you don't. And it's going to be easy for those who have decided to carefully do research to get some answers to therapeutics for COVID-19.
Right. And just for the benefit of our viewers, this is from the American Heart Association, they released a statement when there was a flurry of reports about saturated fat, and this is what they say. Taking into consideration the totality of scientific evidence, we conclude strongly that lowering intake of saturated fat and replacing it with unsaturated fats, especially polyunsaturated fats, will lower the incidence of cardiovascular disease. So even the American Heart Association is saying that saturated fat has not been exonerated, as some people might claim. But so Dr. Esselstyn, you've already mentioned a little bit about this already. You said no oil. So how about like olive oil? Like, is that some people say, that's a heart healthy oil? What would you say to that?
Again, show me the study where patients seriously ill with heart disease. I've been taking olive oil, soaking their bread with olive oil, putting it on their salad. Show me where is the reverse. I wrote a paper last year for the International Journal of Disease Reversal and Prevention. And the title of the paper was, Is Oil Healthy? And I go through a number of animal studies and human studies showing how the oil, including olive oil, will injure the endothelial cell.
Right. And how about, so you already mentioned nuts and seeds. And so you're saying, just to be clear, that if you have cardiovascular disease, you should be staying away. But if you don't, then it might be okay. Is that what you're saying?
In my book on page 69, patients who do not have heart disease, they can eat the nuts. Once they have heart disease, I suppose you could make an argument, but pretend you didn't hear me say this, that you could put 3 of those lovely little walnut halves, 3 of those walnut halves on your morning cereal. Even with heart disease, that would probably be okay. I never say that though, and I'll never say that in a book. Why? Because if I ever say people could have nuts who have heart disease with 3 walnut halves, that's not what people would hear. They would say, Esselstyn said that nuts are okay. Then they'd be in the glove compartment. They'll be in the kitchen, the bathroom, the bedroom, the hallway, the basement. Nuts are highly addicting. And once you start pouring in all that saturated fat, there has again, never yet has there been a study of patients seriously ill with heart disease where you feed them nuts, peanut butter, and cashew sauce and have their disease halt, arrest, or reverse.
Right. Okay. And so you already mentioned caffeine or coffee.
Well, I don't like it, and I'll tell you why. There's an Italian and a Greek study. The Italian study took healthy young subjects, and they divided the group in half. Half of them had coffee with caffeine, the other had decaf, and then they would do, after they drank, they would do the brachial artery tourniquet test, which is a test for endothelial function. Then they switched groups. The group that was previously having coffee with caffeine was now having decaf and so forth. It was always the group that has the coffee with caffeine that injured endothelial function.
Right. So you're saying we should stay away from coffee.
That's what I'm saying.
We drink a lot of coffee in Canada. But I think you're right.
You have a lot of heart disease in Canada.
Yeah. How about alcohol? Some people say alcohol is good for the heart. What do you think?
Is that what the Okinawans do? Do they have three glasses of red wine every evening in Okinawa?
So you
Look, let's be honest about it. Alcohol is a toxin. It is toxic to your brain. It is toxic to your liver. It is toxic to your heart. But I will allow people, certainly, if they want to have a drink on Friday night or Saturday night, not Friday night and Saturday, but that's 1 drink a week, I think is probably fine. On the other hand, somebody says to me, every night I like to relax with 3 glasses of wine. I'm not on board for that.
Women,
right.
women.
Now, how about plant-based burgers? So these like Impossible Burgers and Beyond Meat burgers.
No. That's a phony. They're also high in sodium, right? There are so many of them. Interesting enough, has some heme iron, and they have, or some of them have oil. And I had a couple of patients in my program who actually thought that this was their salvation because they are delicious. And they had heart attacks.
Right. So you recommend staying away from these things?
Yes, for sure.
Final question before we get to the questions from the group here. You wrote once, you wrote in 2010 about adherence. You say here, adherence is the key factor upon which arrest and reversal therapy depends. And in your career, you've had good success helping people actually stick with a plant-based eating pattern. Now, if somebody's listening and they're saying, you know, what Dr. Esselstyn says sounds right, it sounds good, but this sounds like it's going to be very, very difficult to do. What will be your message to these people who are listening?
Well, I think a couple of points to make. First of all, we are not asking patients to eat any food that they haven't eaten all their lives. The foods that are on our program are those that people have been eating all their lives. What are they? They're whole grains for your cereal, bread, pasta, rolls, and bagels. 101 different types of legumes, beans, and lentils. All these marvelous red, yellow, green leafy vegetables, sweet potatoes, white potatoes, and some fruit. The thing that we take away are the things that I mentioned earlier, the things that are going to injure your endothelial cells every time you eat. Those foods we mentioned are oil, animal protein, dairy, and sugar. Now, if you want to really get patients to adhere, if you think you're going to do this in a 12 or 15-minute office visit without the spouse or significant other, you're dreaming. That's not going to happen. If you're going to have somebody make a lifestyle change, you must show the patient respect. The only way that I know to show a patient respect is to give them my time. And for our seminar that I conduct once a month, usually for no more than 12 or 14 patients, they're going to learn in a 6-hour seminar. They're going to learn all about how they created their disease and precisely how we are going to empower them as the locus of control to halt and reverse their disease. And I think the key thing that also helps is that 2 weeks before the seminar begins, my secretary will send me a list of the names and telephone number of everyone who's coming, which allows me to call every one of them beforehand so that I can get my arms around their story and at the same time permit them an opportunity to ask questions of me so that when they do come to the seminar, we already have a strong platform from which we can move forward. I don't know of any other cardiologists or physicians who treat patients that way. And I think it gives the patients a sincere feeling that we really care about them and we want them to really begin to practice this type of lifestyle medicine so they can halt and reverse their disease. And the other thing I think is important to make the patients understand is the relationship, and this gets a little bit into science, but it ought to be in the vocabulary that they can get their arms around. And that is, they must understand the relationship between the endothelium and nitric oxide. Once we've been talking about this for an hour, they are so imbued with the fact that now they understand and recognize the only reason they have their disease was that they created it by destroying the ability of their endothelial cells to make enough nitric oxide so that when they ran out of nitric oxide, they began building up these plaque. And they understand that why would they ever want again to eat something that is going to further injure those few remaining endothelial cells and have another or a final heart attack? Makes no sense. Can you imagine anybody who's been there for 6 hours coming up to me afterwards and say, Dr. Esselstyn, my gracious, that was certainly fascinating. But you know, Lois and I are going to have our 35th wedding anniversary in about a couple of weeks. And boy, am I going to destroy some endothelial cells that night. Not going to happen. If they got a brain in their head, they're there not to make their disease worse. They're there to understand how they can be embodied, they can be actually empowered as the locus of control to halt and reverse their disease.
So do you recommend going cutting cold, or do you recommend just slowly transitioning? What do you think?
Oh, no, you gotta, oh no, you don't do this. You got to do it cold turkey right away. Why? Because the Monell Chemical Sensus Center in Philadelphia has done an interesting study where they took 3 groups of patients. One group was getting 34% fat, the other was at 20% fat, and the other was at 11% fat, where we are. One of those groups at the end of 12 weeks has now completely lost their craving for fat. Which group? Right, the one at 11% where we are. If you don't do that, if you try to do it gradually, you see what we're doing when we succeed, we have downregulated the fat receptor in the brain, and we have downregulated the sugar receptor in the brain. If you're good all week, and then you decide to let your patients belly up to the trough on the weekend and have all this food, the receptor doesn't get downregulated. They're constantly in a state of denial and misery, and you end up with recidivism, and it doesn't work. So you got to have them understand that and get after it right away.
Thanks so much. We're gonna get to the questions now, Dr. Esselstyn, and for our audience, we're gonna try to get to as many as possible. And I'll say the name of the person who gave the question, and then the question that Dr. Esselstyn will answer. Sorry if I don't say your name correctly. So first, we have a question from Jay here. Question for Dr. Esselstyn: can we get too much plant protein? So we know that we can eat too much animal protein. How about plant protein? Like, for example, he says the question was, can we eat too many beans, for example?
No, I've not seen that. As a matter of fact, I think you have to be sort of sensible about anything. You know, you can kill yourself by drinking too much water.
Right.
So, I mean, to sit down and eat beans all day would be kind of crazy. But I think if you sit down and have beans be a regular part, because across the earth, there is no more of a magic food for the patients or for cultures which do not have this disease. It's amazing how many 101 different types of beans are utilized. They can be a wonderful staple for practically every meal, but I would simply use common sense, and with all the wonderful varieties of plant foods that are available between the grains, the legumes, and the green leafy vegetables, you can absolutely have a treasure house of wonderful recipes, either in my book, the one by my wife and daughter, the one by Neil Barnard, the one by John McDougall. There are hundreds and hundreds of wonderful recipes out there.
Thank you. We have a question from KG. It's a very interesting question. I'm working as a nurse in an isolated community. Any advice on how to navigate recommending a plant-based diet in communities facing food insecurity? So I'm guessing these are lower socioeconomic, and you know, they say like plant-based nutrition is like more expensive and so forth. So any thoughts on that?
Thoughts on the expense and thoughts on the expense of plant-based nutrition. My son Rip, who was a fireman and then worked for Whole Foods and then wrote several books on the Engine 2 diet and so forth. And he holds a number of immersions around the country, and just had one this past weekend. And at one time, I think they looked up at Whole Foods, when you buy with beans and a bunch of other things, the cost came out to something like $5.73 for the day. So you have to be, you know, a little creative about it, but you don't have to spend the family fortune trying to eat with plants. As a matter of fact, it's really much more economical when you really step up and do your homework.
Right, I like the way that Dr. Barnard says. He says rice and beans cost pennies.
Right.
So it's actually cheap when you think about it. All right. We have here Sarah. So back to the oil thing. I think people have questions about this oil thing. So Sarah says, some people use oil as supplements like flax oil and black cumin seed oil. Your thoughts?
I have no trouble with people who want to use a tablespoon or two of flaxseed meal on their cereal in the morning. But as far as going into the oil, that becomes problematic. Oil will injure endothelial cells.
Right. Okay. And we have a question here. What are the best foods for visceral fat and clogged arteries? I guess you've already mentioned a little bit of that. So how about visceral fat? Is that the same diet that you'd recommend?
Yeah,
Same plant-based nutrition.
yeah.
Now we have here a question from A.V. Winkler. At what age can you find if at what age you can find out if you have high cholesterol level due to genetics, and what will be the LDL level if it is indeed genetics while eating plant-based nutrition? So
Uh,
do you have high cholesterol because of genetics? I guess that's the question.
well, what you can find, I don't, let me put it this way. Let's take 1,000 patients, 1,000 persons who will absolutely wonderfully adhere to our plant-based lifestyle. There will be some who will have a total cholesterol of 102, 140, 180. Oh my gosh, I forgot. You got Canadian units. I bet nobody's understanding what I'm saying.
Yeah.
What? Is that right? Oh my goodness. Well, I'll just say there'll be a wide range, even who are absolutely 100%. So what does that tell us? It's nothing that's genetically wrong. It's just that everybody has a different thermostat in their liver that, depending upon what their cholesterol needs are. Remember, cholesterol comprises the cell membrane of every cell. Cholesterol is part of our sex hormones, and cholesterol is the foundation for vitamin D. So cholesterol is sort of essential. And it's interesting that one of the things that we found out was that as long as people are eating in a way to maintain an absolute endothelial fortress, in other words, as long as your endothelium isn't injured, if you have a few extra molecules of cholesterol coursing through your bloodstream, that should not be a problem. There are many people who have a cholesterol of over 200 who live a full life without heart disease. If you've got an absolute fortress for your endothelial cells, that should not be a problem. And that, anyway,
Right. Okay. Now we have a question here, Norcorn. So again, this is about oil, and the question is from Norcorn, sorry. Why does oil injure the endothelial system? So I guess the question is why. So you're saying no?
Yeah, what you're simply asking is, how does that, and that's going to be the next bit of research that is going to be forthcoming. Everybody wants to take it down another notch. After we tell you what the mechanism is for how oil injures it, you're going to say, well, how did that get started? Well, how did that one get started? And so forth. The takeaway message today should not be the mechanism, which is not yet understood. What should be the takeaway message is oil injures endothelial cells promptly, as I told you from the study from Italy.
Right. This is from Jane. For those who do not have cardiovascular diseases, do you think it's okay to include unsaturated fat in your diet? Or do you just recommend taking it out completely? So
I don't think you go out of your way, because it was in my review of doing that paper that I told you I published in the International Journal of Disease Prevention and Reversal. Is oil healthy? When you go through the research carefully, yes, saturated fats are the most dangerous, and trans fats are dangerous. And then you come to monounsaturated, which are more dangerous than the polyunsaturated. So the polyunsaturated are less harmful, but I really don't go out of my way to ask anybody. Those that are naturally found in food will be fine. but I wouldn't start pouring fats on your food.
Right. Okay. I have a question here from Will. Um, I live in a true food desert, 430-mile round trip to a Walmart or Costco. Dr. Esselstyn's approach turned me around after mitral valve repair 3 years ago. My challenge is getting those 6 servings of greens per day. So the question is, do you have any recommendations regarding indoor green growing? So I guess maybe the question could be like, how do you get those 6 servings? Maybe that we could put it that way.
Well, I wonder why he's doing it just for mitral valve. Mitral valve repair is a mechanical problem that probably had nothing to do with nutrition, but I certainly support and admire the fact that when you transition to whole food plant-based nutrition, as he apparently has, and he wants to take the extra greens, you're just going to simply enhance your health even further, because it's not only cardiovascular disease that we should be talking about today. When you're eating plant-based nutrition, you also eliminate diabetes, you also eliminate hypertension, you also eliminate strokes, vascular dementia, Crohn's disease, ulcerative colitis, rheumatoid arthritis, lupus, multiple sclerosis, allergies and asthma, and the list goes on. Medicine has never before had really such an absolute incredible toolbox. It's whole food plant-based nutrition. It is so encompassing and so powerful.
Now I have here from A.V. Winkler. And this is a little bit personal. I have a family with lots of heart disease history. In fact, I lost my dad last year to it. And while we were mourning his loss, we got to discuss the reasons for what's happening in the family. My entire family just states it's all genetics. I heard that for the last 9 years since I went plant-based and trying to help my family and my dad. There's no way to convince them. How do you deal with those views? Even when I present facts, it doesn't help. So I guess this person is with family members. They're just not really buying into it. And so do you have any
Well, yeah, but it's very difficult
input into this?
To ask close family members about a lifestyle change, especially if they've known you all their lives. You do not somehow, even if you've got the facts, you do not represent the hard science that they can divorce themselves from the emotion and say, my God, this person that I've known for 30 years and has been with us really knows all the answers. That doesn't happen. It's very difficult for you when you're in the family. You've got to somehow have these patients be exposed to perhaps the kind of thing that many people are hearing tonight on Dr. Cho's program, because there are going to be some things that I've said that people are not familiar with, but I usually say these things fairly forcefully, and I can back it up. I can back this up by everything I said, by the research that we've done. And we have published this in peer-reviewed scientific literature. We know what causes heart disease. We know how to reverse it. You can go to, you can have your family go to YouTube. You can hear some of the presentations that I've given, or on my website, or see the movie Forks Over Knives, or read my book, Prevent and Reverse Heart Disease, because this is not a fairy dust. This is absolutely hard facts.
Yes, and for the questioner, we're recording this webinar, so maybe you can message us, and when we have the recordings, maybe we could send it to you, or we can get you connected, and maybe you could send this to them. Maybe that'll be helpful. All right, a few more questions here, Dr. Esselstyn, if you don't mind. Cheryl Beckwars asked the question: at what point can you remove a statin from a patient who is newly 100% plant-based diet?
Would you repeat that one, please?
Yes. At what point can you remove a statin from a patient who is newly plant-based diet, 100% plant-based diet?
Yeah, I don't really like to get into a wrestling match about the medication so much. I'll tell you how that works. The seminar that I mentioned that I conduct once a month, patients come from throughout Canada, throughout the United States, and from overseas. All these patients, when they come to see me, have a primary care physician and they also have a cardiologist. And they also are on a boatload of medications. We've done, I guess we've now evaluated something like over 1,000 patients. Can you imagine what chaos it would be if I were to try to monitor the medications of those 1,000 patients with advanced heart disease? So what we do is, when they come during this 6-hour seminar, they are going to learn, as I've told you several times tonight already, they're going to learn all about how they created their disease and precisely how we are going to empower them as the locus of control to halt and reverse their disease. And when they go back home, usually after 2 or 3 months, they are scheduled to see their own cardiologist again. The cardiologist will say to them, "My goodness, you've lost some weight. And I noticed that when I just checked your blood test again, your cholesterol has come down. We're going to have to reduce your cholesterol medication. That is the statin. We're going to have to cut that in half. Your blood pressure is almost normal. We're going to have to really almost stop your blood pressure medication. I noticed your diabetes has just about disappeared. And what are you doing?" And the patient will say, "Well, I saw this doctor up in Cleveland." and then some of the patients will then ask the doctor, "Why did I have to go to Cleveland to do this? Why didn't you show me how to do this?" And a very honest answer will come from the cardiologist and say, "Well, I learned about this, but I haven't found that any of my patients will do this." Well, why is that? It's not that the message is wrong. It is how the message is articulated. He's going to give his patients 12 or 15 minutes without the spouse there and without telling him anything about the science or the depth of this. You're not going to have any success. When you respect a patient, give them the 5 or 6 hours. Give them the notebook, give them the books, give them the information. I only get to see these patients one time, but when we wrote up 200 of them, we were running close to a 90% adherence. Yeah.
Wow. All right, we're pretty much at the end of time. So I just want to ask you one more question, one more thing for you to comment on, Dr. Esselstyn, and then we'll call it quits. You wrote here in a paper, 2016, you wrote here, we're at the cusp of a seismic revolution in health, which will never come about with the invention of another pill, procedure, or operation. Whole foods plant-based nutrition is the mightiest tool medicine has ever had in its toolbox. So my question is, you're saying here is there's a seismic revolution. So in terms of lifestyle medicine, do you see that revolution happening? What are you observing? What are you seeing? Do you think we could see more doctors, for example, practicing this and encouraging their patients like you do? Do you think there is going to be a change?
Well, yeah, I can recall back in 1991, I organized in Tucson, Arizona. I organized the first national conference on the elimination of the elimination and reversal of cardiovascular disease, and we had 100 people there. And then nothing much happened after that, so I organized another one that was held down in Disney World in Florida. We had 500 people, doctors and nurses, and it began to get a little bit more interest. And now, I just was looking at last year, before this coronavirus hit, there was something like 8 different national meetings on plant-based nutrition. And American College of Lifestyle Medicine, Patrician, Neil Barnard's. I mean, they're just Dr. Orn Oswell. They're just springing up all over the place. And it really, we're not there yet, but my gracious, it is light years away and different from what we had before. Because as I mentioned, what will bring this seismic revolution around is when we have the will, the grit, and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them to absolutely annihilate chronic illness. Thank you.
Well, thank you, Dr. Esselstyn, and I just want to personally thank you for impacting my own views on medicine. Your papers are very insightful, very provocative, I gotta say, and but they really shaped my thinking as well, and for many others as well. So we hope that you continue to do your work and continue to write and impact more people. For those of you who are listening, again, his book is Prevent and Reverse Heart Disease. This is the book. Dr. Esselstyn, is there going to be any new editions coming out, or this is kind of it for now?
Oh, I know. Well, it's really time to revise it and update it, and hopefully in the next year or two that'll happen.
Excellent. So we can look forward to that. And for those of you who haven't seen the documentaries that Dr. Esselstyn is featured in is Forks Over Knives and What the Health. So we want to encourage everyone to look into those. And we always want to thank the partners. Pathways to Wholeness Lifestyle Medicine Clinic is a clinic in Toronto. So if you're in the Toronto area and you'd like to have naturopathic and lifestyle medicine that favors plant-based nutrition and a lifestyle approach, you can contact at this website. And Lifestyle is Medicine is a non-for-profit that puts on this program and webinar. We want to ask that you continue to follow to learn more of what's coming up. We have a program on diabetes coming up this Sunday, and we hope that you can tune in. And also we have one program also on the gut microbiome from a gut researcher talking about how nutrition affects the gut microbiome. So thanks everyone for coming, and we hope you enjoyed and learned something, and God bless you.